Hey everybody, welcome to this Caregiver Coffee. My name is Matthew Estrad. I'm a gerontologist in St. Tammany Parish, Louisiana, and I've been partnering with COAST, or the Council on Aging in St. Tammany, for over 10 years, mainly as a caregiver support group facilitator, but also about half of that time has been bringing you this Caregiver Coffee segment where we try to bring some kind of information to you about health, about caregiving, about staying independent as you and we age for as long as it makes sense in the setting that we prefer. So today's topic will be safe driving as we age. Very important topic, very interesting topic, one that's important to me. And I think everyone needs to know about this because at some point, all of this will need to stop driving. Most of that will be, us voluntarily recognizing those signs in ourselves and our loved ones and saying, it may be better to have other arrangements. So, and it could feel scary. Um, but anyway, it's all through education. We'll have this, hopefully that this will help. All right, so before we get into this article that's published by the National Institutes on Aging, or the National Institute on Aging of NIH, just a quick plug about the caregiver support group that I facilitate for the Council on Aging. So it's on Tuesday evenings, most Tuesday evenings of the year, from 6 p.m. to 7:30 p.m. And sometimes we're in person, sometimes we are virtual. And we meet, like I said, on Tuesdays, just about every Tuesday of the year, exceptions being Christmas and Mardi Gras, etc. And when that happens, usually we try to move it and not cancel it completely. So the best way to stay tuned on that, two things. One is to join the email list, the private email list, where and so on Tuesday mornings, I'll typically send out an email reminder, let you know where we are, or remind you where we are. And the other one is to be another reason to be on that list is because I send out the calendar. So that's number two. There's a calendar that I email out, and I was also on the Coast Seniors website under Caregiver Services. We publish it every 2 months. So right now we're within the May-June 2025 calendar, and I'll be publishing one for July and August pretty soon. And that's helpful because you can print it out, put it on your refrigerator or a door in the house, and it's got the address on it for the for our in-person. It also has the phone number and Zoom link for the for our online activities. So, and it's good because if we end up moving from a typical Tuesday to sometime either like a Monday, sometimes we go back to a Monday, or it's later in the week. There you have that exception on that specific calendar. So I hope that you'll consider subscribing for that mailing list. All right, so let's dive into this article. And as usual, I'm going to try to keep this the entire video to 15 minutes or less. So I'll start with they have Sheila's story here. I'll read that to you, and then we'll go through the rest of the article. So at age 78, Sheila thinks that she's a good driver, but this year she's had one minor accident and several near misses. She also noticed a few new dents in her car that she doesn't know how they got there. Lately, her daughters have begun offering to drive her places that she normally gets to on her own. Sheila wants to keep driving as she gets older, but is starting to wonder how she can stay safe behind the wheel. All right. So there are common health conditions and medication side effects that may influence driving. The first one is stiff joints and muscles. As you get old, our joints all get stiff, and this is me too. So this is not just you watching this and our loved ones. So our joints get stiff as we get older. Our muscles may weaken. We may develop arthritis, which is very common, and that could affect our ability to drive. It makes us harder to turn our back. I'm sorry, turn our head to look back, to turn the steering wheel quickly, or even to brake safely. And if pain, stiffness, or arthritis seems to get in the way of driving, we must talk to our doctors and think about getting hand controls for both the gas and the brake pedals if you have leg problems. I've not seen those before, but I'm glad that they mentioned it here in the article. So another aspect, in addition to stiff joints and muscles, is trouble seeing. So the eyesight changes, right? As we get older, it's harder to see people, things, and movement outside the direct line of sight. So we know our peripheral vision begins to be impaired as we age, and even it gets worse if we have dementia, but even without dementia. So a little experiment while you're with me is to put your arms out like this, just straight out right here, and then look forward and start wiggling your fingers. Okay, start wiggling out here, but continue to look forward and slowly start to bring your your hands this way and stop where you start to sense through your peripheral vision, you sense the wiggling fingers, and that'll tell you what your field of vision is. So this is not an eye exam, right? But it gives you a good indication of some areas that you may not be able to see. Whereas most of us, when we're young, we see to the sides, 180 degrees. So that changes as we get older, and that can impact our driving. So also glare from oncoming headlights may be difficult depending on the time of the day. The sun may be blinding, and as the sun goes down, it may be difficult to drive at night. So these are things that we often notice, but do we do anything about it? Do we take precautions? And many times we might not because we don't want to face the idea of not being able to drive. But I would say that it doesn't mean you go from driving to not driving, that you try to do things that are going to help if it's things like eyesight and even the, stiff muscles and joints, etc. Trouble hearing could be a factor. There is a factor to look at. As you get older, our hearing changes, making it harder to hear horns, sirens, or noises even coming from our own vehicle. And these signs, these sounds are things that tell us that something is not right. There's something that's happening. It could be a mechanical issue. It could be an ambulance behind you that needs to get around you. So hearing is very, very important. Medications, some medications can make you feel lightheaded, make you feel drowsy, make you feel foggy or less alert. Especially, I would say not especially, but even if a doctor has prescribed something, there are doctors that don't realize that a drug might have an anticholinergic impact, which can cause fogginess, which you don't want to be experiencing when you're driving or even walking. So it's important to reconcile your medications and to be aware of the side effects you may be feeling and not ignoring those. Next is slower reaction time and reflexes. As we get older, our reflexes might get slower. We may not react as quickly as we have in the past. And combine that with stiff joints and muscles, possibly weaker muscles, can make it harder for us to move quickly in time to avoid another car or a person, a cyclist, or anything like that. Loss of feeling or tingling in your fingers and feet can make it difficult to steer or to use foot pedals. And the last tip here specifically is some medical conditions make it unsafe to drive. Sometimes uncontrollable movements and loss of coordination and balance due to Parkinson's disease, for instance, can make it unsafe to drive. And sometimes loss of control or limbs or other movement limitations that are following a stroke might mean that it's no longer safe to drive. So, and again, you talk with your doctor about it, you talk with your family about it because you're unique and special, and your body's going to do different things than mine and have different abilities than mine. So beware of that. I'm not telling anyone to stop driving right now, but these are things to be prudent. In the early stages of Alzheimer's or other types of dementia, some people are able to keep driving, but as memory and decision-making skills get worse, it may be likely that you need to stop. But the key is that we don't do this right away just because there's a diagnosis. There's that certainly brings some caution, but but we look at the individual person and their abilities and their deficits and what they're still able to do. And even then, it's the person safe to drive even within the neighborhood to go to the grocery store, to go to mass, to go to other things. So it's not just here we're taking the keys away. It's, it could be a limited thing. It could be. All right, we have a few minutes, some top tips for older adults to drive safely. Talk with your doctor. I've said that a bunch of times. Continue to do that. Some doctors are very vigilant about this and good about it. Some may not want to talk about it. Some may not want to be the person to take away the keys. Um, but it's important to talk with them, to bring it up yourself if they're not bringing it up. To be physically active. That's the next tip. This will help you to keep and even improve your strength and your flexibility. So there's something we can do about that. No matter our age, we can stretch, we can be active in things that we enjoy doing, not things that it doesn't have to be drudgery. Staying active, and if driving is important to you, and it is for most of us, I encourage you to stay active. Consider your car. If possible, drive a car with an automatic transmission. I think most people do that already. Power steering, yes. Power brakes, large mirrors. Consider backup cameras if they didn't already come with your vehicle. Those are more common now. They're not difficult to get aftermarket as well, even if they're not professionally installed. Sometimes that can be a big help. Take care of your ears and your eyes, making sure that those are all working. So just like with staying physically fit, this is something we can do something about, something we can perhaps make adaptations to for a while. Avoid driving certain times of the day. Cut back on driving at night. Be careful if you're driving and there is a particular glare. This might be something you can get help with as far as like, sunglasses that are going to be helpful, that are uh, shaded enough or tinted enough rather. Maybe you need something for the side. So whatever your doctor can recommend, your optometrist can recommend, consider that. Check in with yourself. If you feel lightheaded or drowsy, consider not driving, not going to where you were going to go, or to ask somebody who can give you a ride. Don't crowd. Leave ample space between your car and the car in front of you. Think reaction time and think vision with those types of things. Plan your timing and avoid rush hour traffic, avoid heavy traffic areas when you can. Plan your route. Drive on streets that you know well and that require few or no left turns. That's when we usually get in trouble, is a left turn, because typically we're having to yield to someone, another car coming towards us that's going straight. Wear your seatbelts. Of course, enough said on that. When in doubt, don't go out. Consider the heavy thunderstorms, or if you're in an area of the country that experiences snow, sleet, hail, things like that, avoid that altogether. Limit distractions like your radio or certainly your phone, texting, etc. It can wait. Focus on the mission at hand. Use window defrosters to help keep your windows clear. So that can be like in Louisiana, that can be like the condensation that builds up, or the dew that's on the back windshield, the rear windshield. It could be ice at times here, and ice certainly other parts of the country. And then you can also get your driving skills checked by a driving rehabilitation specialist. I know of at least two here in Louisiana. You can go to the American Occupational Therapy Association. I'll say that again. American Occupational Therapy Association, and through their database, find the driving specialist and have them assess you objectively and offer their professional advice. And it's probably it's gonna be only a handful of options. It's gonna be keep driving like you are, keep driving with these limitations. Keep driving, and here are some things to adapt and to make things easier and safer for you. And then sometimes it might be it's time to start to limit, or sorry, it's time to limit it completely. Or I'm sorry, to stop driving completely. And if that's the recommendation, then we want to follow that recommendation because it's going to help keep you safe. It's going to keep other drivers, pedestrians, etc., safe as well. Keep them yourself healthy, keep yourself healthy, and keep yourself out of financial and legal issues that may come from that. So again, I'll close with the thought that this is going to happen to most of us, where slowly over time we lose this ability, and we will need to voluntarily, hopefully, and cooperate with others that might be suggesting that, hey, let's get you a ride, sort of thing. So I will have to face this one day. And hopefully I do it with as much grace as you will, who are watching. So thanks for being here. Thanks for supporting the Council on Aging in St. Tammany. And I look forward to bringing you the next Caregiver Coffee to you. Take care.